Okay, so if you've been following the news at all, artificial intelligence is just, it's everywhere,
Yeah.
especially in healthcare.
Absolutely everywhere. The buzz is huge.
Yeah. And the headline, they promise these, well, almost miraculous things. AI diagnosing diseases better than humans sometimes, or personalizing treatments.
And automating tasks, too.
Exactly. Automating, a lot of that routine stuff, the time-consuming tasks doctors get bogged down with.
Which sounds fantastic on paper.
It really does.
Yeah.
And look, it's not just hype floating around. We're seeing real tools out there already,
True. There are concrete examples.
like AOD that's used a lot for spotting strokes on CT scans, I think.
Yeah, acute stroke detection, that's a big one. And Viz AI for things like pulmonary embolisms.
Right. So these things are actually being used. They're making a difference, genuinely changing lives.
Definitely improving outcomes in specific areas. These are often computer vision type AI tools, really powerful for diagnostics.
So you'd think with all that proof, all that utility, AI would just be, standard practice, part of every doctor's day.
That's the logical assumption, isn't it?
But here's the twist, and this comes straight from our source material today. Despite the incredible promise, despite these tools existing, a lot of doctors, maybe even most doctors, are not using AI day to day.
Yeah. That's the surprising part.
When I first read that, honestly, it made me pause. It just feels like a huge disconnect, doesn't it?
It really does. Potential versus practice.
Okay, so let's try and unpack this then. In this deep dive, we're going to dig into the complexities here. Why isn't this massive potential translating into widespread daily use by clinicians?
Right.
And we're drawing our insights from a YouTube video transcript. It's called AI in Healthcare. How many doctors really use it? From the channel AI for Physicians Bridging Healthcare and MedTech.
Okay. And what's really fascinating here, I think, is that the promise is huge, no doubt about it. But the reality on the ground is just, well, it's complex.
Complex is a good word for it.
So we'll be looking at what makes doctors cautious, what those practical hurdles actually are, and maybe what that means for you listening in as healthcare keeps changing.
So where does the source suggest the caution comes from primarily? Is it just about accuracy?
Well, accuracy is part of it, definitely. But our source highlights something maybe even more fundamental: trust and transparency.
Ah, the black box issue.
Exactly. Doctors have years, decades sometimes, of training and experience. They rely on that rigorous process.
Right.
And while AI can assist, there's this skepticism, not just about whether the answer is right, but how the AI got there.
They can't see the working.
Precisely. If the AI's decision feels like it came out of a black box, maybe because the deep learning model is just incredibly complex, it's really, really hard to build trust.
I can see that.
Without understanding the reasoning, doctors are understandably hesitant to just, well, rely on it fully, especially for critical decisions.
So it's not just trusting the what, it's trusting the how.
Yes. Which, interestingly, kind of mirrors how clinicians are trained, right? They need to validate every step in their own diagnostic thinking.
That makes sense. So it's not enough to prove it works, you have to show how it works. But hang on. If an AI can demonstrably, like statistically, outperform a human on certain things, is there a risk, according to the source, that demanding this deep transparency from really complex models might actually hold back useful innovation?
That's a really good question. A central tension, actually.
Yeah. Is there a middle ground? Or does it have to be fully explainable AI or nothing?
Well, the video does suggest that explainable AI is a huge research area trying to solve exactly this. But
Right.
the current reality for a lot of the AI systems already out there still feels like a black box to the user.
Okay.
And clinicians, they have to prioritize patient safety above all else. They need to understand why they're recommending a certain test or treatment to feel okay putting their name to it.
Right. Accountability.
So yeah, while innovation is vital, that trust and accountability piece seems paramount in medicine. It sort of dictates the pace.
Okay. That feels like a major hurdle. And you mentioned processes earlier. The source also talks about just how busy doctors are.
Oh, absolutely. The video stresses this point. Clinicians are often incredibly stretched, thin, immense pressure, packed schedules.
We hear that all the time.
So even if you have decent training or onboarding for a new AI tool, integrating it can still mean adding extra steps or needing big adjustments to a workflow that's already bursting at the seams.
It's not just, is the tool good? It's, does it fit without causing chaos?
Precisely. Does it slot in easily, or does it add friction?
But what about the argument that, sometimes you need a bit of initial friction for a big long-term gain? Does this source suggest doctors are maybe too resistant to change or just genuinely too swamped to see the bigger picture with AI?
The source seems to lean more towards overwhelmed. It's less about being resistant to the idea of AI and more about the practicalities. If an AI solution doesn't offer really clear, immediate time savings, or if it isn't so smooth it's almost invisible,
Yeah.
it risks becoming just another burden, another thing to learn, another thing to manage on top of everything else.
Instead of a help, it's a hassle.
Exactly. So for a doctor already at their limit, adding complexity, even promising complexity, can be a huge turnoff for daily use. It's very practical.
A practical barrier, not necessarily an ideological one.
That's a good way to put it. And then, layered on top of all that, is the liability question.
Ah, yes. The who gets sued question.
Pretty much. And it's a really weighty issue, not just theoretical. If an AI tool contributes to or directly causes a misdiagnosis, who's legally responsible? Is it the doctor who clicked the button or the company that made the software?
That's a huge gray area.
It really is.
Yeah.
The video points out that regulations here are still catching up. They're evolving. There aren't many clear precedents, established legal frameworks for AI errors. And that uncertainty makes a lot of clinicians very, very cautious about fully trusting AI, especially when the stakes are so high. Patient health, patient well-being.
That legal fog could almost paralyze adoption on its own, couldn't it?
It's certainly a significant factor slowing things down, but it's not just individual doctors feeling this pressure. The source also mentions systemic challenges, right?
Yes, it did.
Yeah.
What does that cover beyond the individual doctor's day?
Well, think about the healthcare systems themselves. They're complex beasts. You've got political factors, budget constraints.
Always budgets.
Always. And then there's the legacy infrastructure problem, decades of tech built up, often in silos.
Like electronic health records that don't talk to each other.
Exactly. Fragmented EHR systems are a classic example. Or just hardware that isn't powerful enough for the number-crunching modern AI needs.
So the pipes aren't ready for the new water.
Kind of. And beyond the tech, medicine as a whole is just, well, it's a culture built on caution, on proven methods, on first, do no harm.
A very conservative culture in that sense.
In that specific sense, yes. So for AI to really break through and become widespread, it doesn't just need to prove it works technically.
Right.
It also has to fit into that established culture. It needs to demonstrate clear, trustworthy benefits that resonate with that cautious approach and somehow overcome all that built-in technical and organizational inertia.
So many layers.
Definitely.
Yeah.
So just to kind of pull those threads together again, the potential of AI is real, absolutely. But getting it into widespread daily use, that hinges on tackling these really practical, deeply rooted issues.
Okay.
We talked about the transparency issue, the black box, and the need for explainability.
Right. Trusting the process.
Then there's the huge burden of actually integrating these tools into workflows that are already packed.
Friction factor.
And the big unresolved questions around liability, who's responsible.
Yeah.
And all of that is playing out against the backdrop of these larger systemic challenges, the old infrastructure, the cautious culture. These are the real hurdles keeping the promise from being today's reality for most doctors.
That paints a much clearer picture.
Yeah.
So, thinking about our listener then, what does all this mean for you?
Yeah, what's the takeaway?
Well, I think this deep dive really shows us that putting powerful new tech into a field as critical and as cautious as medicine, it's never going to be simple plug and play.
No, definitely not.
It's a really good reminder that even the most revolutionary sounding tools have to earn their place. They need to build trust, show clear, reliable benefits before they become truly indispensable.
Absolutely. And maybe if we connect this to the bigger picture, it leaves us with a really important question to think about.
Okay.
As AI keeps getting faster and more sophisticated, offering even more complex solutions, how does healthcare strike that balance?
Balance between what?
Between the drive for innovation, for better diagnostics, for efficiency, and that fundamental human need for trust, for accountability, especially when the decisions being made directly impact our health, our lives. How do we navigate that as patients, as a society?